Good afternoon and welcome to Connecting Communities. Today's webinar is High Quality Early Care and Education, Cost, Affordability, and Racial Equity. On slide 2, I would now like to take the time to introduce our speakers for today. Catherine Townsend Kiernan, a research analyst at the Federal Reserve Bank of Atlanta. Sam Evans, a community development advisor at the Federal Reserve Bank of St. Louis. A mother and parent focus group facilitator. Diane Halsey, Senior Vice President of Family Engagement at Think Small. Yvette Sanchez, Vice President of National Policy at Start Early. Susie Lalich, Senior Director of Employee Success at printingforless.com. And I'm Matushka Lindo-Briggs, Director of Special Projects and Strategic Support for the Community Development Department at the Federal Reserve Bank of St. Louis, and I'll serve as your moderator for our session today. Let's move to slide 3, where we can take care of a few housekeeping items before we get started. For the best webinar experience, we recommend you use the web stream to consume this live video event through your computer speakers. If you have technical issues, you are welcome to dial into the phone number posted on the player page, but the video will not sync perfectly with the phone audio. This session will be recorded and the presentation will be available on our Connecting Communities website. Also, in connection with this session, you can find a variety of additional resources available at www.fedcommunities.org. We will be taking audience questions during the event, and we'd love to hear from you. To submit a question, all you have to do is use the Ask Question button located on the webinar player page down on the left-hand side. Or you can email us at communities@stls.frb.org. As we move to slide 4, I need to go over our legal notice and disclaimer since this is a Fed webinar, which is that the opinions and statements expressed in this presentation are those of the speakers and are intended only for informational purposes. They do not reflect official positions of the Federal Reserve Bank of St. Louis or the Board of Governors of the Federal Reserve System. And finally, our mission on slide 5. The mission of the Federal Reserve's community development function is to promote economic growth and financial stability for low to moderate income individuals and communities. You can look at the map to see where your community development team is located. Our work is done through a range of activities, from conducting research and identifying emerging issues to developing resources and sharing ideas, as well as fostering collaboration and building partnerships. I would now like to turn the presentation over to my colleague, Catherine Townsend Kiernan with the Federal Reserve Bank of Atlanta. Catherine, the floor is yours.
Thank you so much for that introduction, Matushka. And I also want to say thank you on behalf of the Federal Reserve System's Early Care and Education Work Group. We're really grateful that you gave us the opportunity to share this work with you today. As Matushka mentioned, I'm Catherine Townsend Kiernan. I'm a research analyst at the Center for Workforce and Economic Opportunity at the Federal Reserve Bank of Atlanta. And I also just want to reiterate the legal notice that the views expressed today are my own and do not necessarily reflect the views of the Federal Reserve Bank of Atlanta or the Federal Reserve System. I'm going to give a brief background of the project that the Early Care and Education Work Group worked on, and then we'll jump into the presentation. So when the pandemic upended our lives in March of 2020, many people began working remotely and childcare centers and schools closed to reduce transmission of COVID-19. As many people did, we saw how challenging closed childcare centers made day-to-day. So we started asking questions about how childcare is affecting the labor market and what unique challenges the sector faces. Centering our research with a lens of racial equity, we looked at how providers face prohibitive cost to their mission of providing high-quality childcare, and also how high-cost childcare limits accessibility for families, especially with low or moderate incomes. The central part of this project was not only to understand these challenges from a historical perspective, but to hear from parents and providers about how they interact with different barriers to high-quality care. With that, let's jump into the presentation on slide 7. We know that investing in high quality early care and education can achieve high financial return for the public. The programs yielding the largest benefits tend to have relatively well-paid and prepared teachers, low child to teacher ratios, and a research-based curriculum. high quality program elements often cost more than providers receive through tuition payments or government funding. The quality of child and teacher interactions and their relationships is the most important factor in achieving positive developmental outcomes for children. Supporting these relationships requires attracting and retaining talented teachers with sufficient wages and benefits, and supporting teacher interactions with children through education and professional development. As you might imagine, retention programs like the one I mentioned aren't cheap, and teacher wages and benefits already account for 60% of costs. However, those wages are relatively low. According to the Bureau of Labor Statistics, the median wage for U.S. childcare and preschool teachers in 2020 were $12.24 and $15.35 per hour, respectively. When you look at these wages for Black and Latin workers, they creep even lower. Next slide. Wages vary between provider types. School-based providers can pay close to or even over $20 an hour, while teachers at programs that do not receive Head Start or public pre-K funding earn a median wage below $15 an hour. Higher wages have shown that there's a reduction in turnover rates. One study based on experimental evidence shows that offering $1,500 in bonus payments over the course of 8 months reduced turnover from 41% to 18% for assistant teachers and from 20% to 14% among lead teachers. While the bonus payments did significantly reduce turnover rates, the rates still remained high compared to the turnover rate, only 4% among school-based teachers with higher wages. Next slide, please. Thank you. So it's clear that providers face a lot of challenges when they're trying to provide high-quality care. But let's explore what impacts that has on families. Before a parent can pick a childcare provider based on the convenience of location, program type, quality standards, cultural values, or operating hours, the parent must know if the provider's rates are affordable. Two simple factors constrain a family's ability to find optimal childcare: their income and the prices childcare providers charge. Finding a solution for quality care is much needed in the market because in most regions, childcare is the highest household budget item, exceeding even housing costs and college tuition. Among families that pay for care, high-income families spend about 6.7% of their income on childcare, while families with low income spend nearly 40% of theirs. We often hear 7% as a benchmark for affordability for childcare expenses, and this measurement might not satisfy how we talk about affordability generally, but I wanted to note that for a married couple with one child, the median price of childcare exceeds this threshold in all states. You can also see here that the age of the child is important when considering cost. For infants, the median price often exceeds 10% and can reach as high as 18%. Next slide. Prior economic literature suggested challenges with childcare affordability can ultimately lead parents who want to work to stay home with their children, work fewer hours, or turn down higher paying roles to avoid benefits cliffs. Childcare costs rose 16% from 1990 to 2011. Over the same period, families who continued to pay for care decreased their use by about 23% fewer hours every week. Some families chose to not pay for childcare anymore at all. Instead, the mothers left the labor force, which happened more often when the children were under the age of 5 or the families were earning a low income. In 2021, there were roughly 35 million workers who had at least one child under the age of 14 with no other adult in the household able to care for them during the day. And during the pandemic, mothers with children under the age of 6 made up roughly 10% of the workforce and accounted for nearly 25% of employment loss. Next slide. Research does suggest that childcare assistance programs, including parental leave, part-time work protections, and childcare subsidies, can boost mothers' participation in the labor market. In the United States, the Child Care and Development Fund is the largest federal childcare subsidy program and provides subsidies so that parents can work or go to school. Families seeking subsidies face obstacles including waiting lists and income eligibility requirements. Those who receive subsidies may experience other challenges, such as significant co-payments or low reimbursement rates to providers, which can limit their options. States have flexibility to establish eligibility parameters for CCDF. Those have generally reduced coverage by 1/3 compared to federal guidelines. In fact, in 2018, only 1 of every 6 children who were recommended for the program received funding. Additionally, eligibility limits for families can inadvertently hinder economic mobility. For instance, when a family encounters a benefits cliff. The benefits cliff occurs when a modest wage increase puts a family above the income eligibility for a certain benefit, in this case, CCDF, and despite the gain in income, the loss of subsidy results in the family being financially worse off. Attempts to address affordability may also interact with other barriers to childcare access, which is a perfect moment for me to turn the floor over to my colleague, Sam Evans from the Federal Reserve Bank of St. Louis.
Thank you so much, Catherine. So I have the distinct pleasure of highlighting some of the key takeaways from our series from the racial equities, looking at the racial inequities that exist in the ECE system, specifically for Black and Hispanic families, as well as highlighting some of the insights shared with us from the parents and providers through our human-centered design focus groups that we held last fall. So I'm just going to kind of cover some of the high levels of what was within that report. But if you have further interest about our process or to read the full text, I definitely encourage you to visit the website, which was highlighted in the email invitation. So if you could go to slide 13, we see that the U.S. Census Bureau's current population survey asked those who are not in the labor force but want jobs why they have not looked for more work. And in December 2021, we see that Black and Hispanic and Latina mothers were more likely than their non-Hispanic white counterparts to experience childcare-related job disruptions, leading many to report working less or not working at all. And this is significant. As Catherine mentioned earlier, parents, particularly women, can increase their earnings by having access to high quality ECE. This lack of access to high quality can lead parents to make different educational or employment decisions. In our article, we highlighted a survey conducted prior to the pandemic, which showed half of Black mothers and nearly half of Hispanic mothers would actually look for a higher paying job if they had access to more affordable and reliable childcare. This was also reflected in comments made during the parent focus groups. If we could, let's go to the next slide. So when we think about the accessibility of these settings of high quality and the myriad benefits associated with attending such settings, we see that Black and Hispanic children are less likely to be enrolled in high quality settings. Childcare on the supply side, especially they're especially low among certain populations, with 57% of Hispanic families, 44% of Black families, and 54% of those living in the lowest income neighborhoods lacking sufficient licensed or regulated childcare providers to even meet the need for the families that are asking for it. Where over half of people are living in the US are actually living in childcare deserts. So this just doesn't affect just Black or Hispanic families. It does also affect our low income neighborhoods, our segregated neighborhoods, as well as our rural populations as well. Some other factors that impact the accessibility needs of Black and Hispanic families include accessing high quality ECE during non-standard or irregular hours. So if you're thinking about requiring evening or weekend support, and if a family can secure a much coveted ECE slot, so even if they are able to even get a slot, or in terms of being able to apply for a childcare reimbursement or subsidy provided through government programs, this often requires time, linguistic or literacy support, and extensive paperwork to substantiate the need for care. The sacrifice that Black and Hispanic parents make to attain childcare is a complex problem fraught with competing challenges. Understanding the conundrums parents and families face and addressing those issues that the ECE workforce and providers are even experiencing when they're trying to provide more seats, as well as providing the quality with those seats, can really help us to foster a more racially equitable ECE. Let's continue to the next slide, please. So both parents and providers, they expressed a high interest and a need for diverse and culturally competent care. This is care that respects the diversity of the population served. And research backs this up. Research also links the benefits of maintaining continuity of cultural and linguistic characteristics and experiences between children's homes, as well as their early childhood settings. Moving on to slide 16. As Catherine noted earlier, one of the main ingredients and one of the highest costs is our childcare staff. Historically, childcare has been largely provided through the unpaid or low-wage labor of women, often women of color. And this legacy may play a role in why childcare has been and continues to be highly undervalued and underpaid. Wages in the ECE system are some of the lowest, as Catherine alluded to earlier. And additionally, we see that there's pay disparities that exist, as you see there on the slide, particularly for Black providers who are paid on average of 78 cents less per hour than their white peers. And nearly a quarter of Black female childcare providers and 15% of Hispanic childcare workers were below the poverty line in 2021. So if we're thinking about our home care providers, or those that are unregulated or unlicensed providers, many weren't able to benefit from some of the supports and resources that came through through the COVID-19 pandemic and some of those funding sources. And so we see that, for instance, many philanthropic or federal or state ECE grants, they required a 501c3 status or licensure, or even just were systematically omitted from some of the key portion of providers offering the in-home care. And unfortunately, even many of these types of ECE settings are closing and providing fewer options for care. And without external intervention and support, these difficulties can become more entrenched over time. Continue here to the last slide. Understandably, we know that childcare program is a complex decision for families and a challenge for providers, especially given the COVID-19 pandemic. But as many of us, we come to understand the childcare system as a whole and not just a set of individual choices, we're able to really understand the robust evidence highlighting how childcare and education is really an essential piece of America's economic puzzle. And by centering parent and provider voices and experiences and meeting them where they are, we can see this as one of the true avenues to being able to help to remove barriers and address the racial inequities in the ECE system. During our focus groups, we heard that providers, they want to be more involved in the policy discussion and considerations. Also, when we're understanding tools such as the quality rating and improvement systems and other nationally accredited accreditation systems that are put in place to really help to empower and inform parents on quality, we first must understand and consider the economic trade-offs that parents are facing, as their first concern is their family's economic security needs. Considering racial equity and the ways in which Black and Hispanic children and parents and ECE educators and providers are often navigating these current systems of support is definitely a first step in effectively scaling ECE. As we transition to our panel discussion, I hope you can take these takeaways with you as we explore through this conversation and dig deeper into some of these key issues. At this time, I'm going to ask the panelists to come on screen. And as they are unmuting themselves and coming on screen, I do want to encourage you, the audience, to being able to ask questions for the panelists into the chat box. So hello. And so with that, we're gonna go ahead and transition to our first speaker, Marika Hamilton, that currently works with the Lincoln Public School in Massachusetts and served also as our focus group facilitator, as one of our focus group facilitators last fall. Welcome, Marika.
Welcome, thank you.
Yeah, well, if you could just please introduce yourself and and also give your perspective as a parent that was moderating our parent focus groups, any insights that you can share from what you heard from that focus group discussion.
Sure. Thank you so much, Sam. So as mentioned, my name is Marika Hamilton, and it is a pleasure to be amongst this awesome panel of women in this month, which is March, Women's History Month. Woo woo. I use she, her pronouns, and while I am here to serve in that my most important role as a parent and a mom of my three heartbeats, Sage, Sydney, and Shem, I am also a school administrator, which was mentioned for the Lincoln School District. And lastly, once I have time to introduce myself, I also like to acknowledge the Indigenous land that I am on, or in this case that I'm zooming in from. And I am currently on unceded territory of the Pawtucket and the Massachusetts tribes, and I acknowledge them as the past, present, and future caretakers of this land. So now that we have that out of the way, for me to dig in as a facilitator for the parent focus group, some of the key themes that I felt like continue to rise to the surface, like driftwood, if you will, were cost and affordability of childcare, which I know all too well, having 3 children that I've had to navigate the systems in multiple ways, from nannies to childcare centers to having them at school with me because it was more cost effective, to religious affiliated centers. The other was access and location, whether that being needing to ensure that their home and work were in close proximity to their childcare so that there wasn't so much travel, whether they were on public transportation or if they were by car. If you still have to travel 45 minutes and you're in traffic to be able to get to a facility because it's not in close proximity to your home, that time that it's taking away and you might be eating breakfast in the car and trying to multitask in so many different ways can be a burden on families. And then the other was just the actual location of the facility. So meaning the type of neighborhood that the facility is located in, and making sure that there's that comfort level that if you're traveling through and you are on public transportation and you're coming at 6 o'clock and it is like daylight saving time in the fall, right? And it's getting darker out, that you're feeling comfortable when you're in those neighborhoods. And then I'd say last, but certainly not least, because it's equally important, was strong culturally relevant curriculum. There was this need for parents and wanting to ensure that their children saw themselves in the curriculum. And what I refer to that is something called experiencing mirrors, so that they see themselves reflected, and parents felt like that was important, that students, that the children saw themselves in their identity and how they reflected, not just in the lesson plans, but also in the staff, in the books, in the pictures, and the activities that they've had in the classroom. And I know, particularly in some cases, the only times that I saw in some of the suburb facilities there being any multiculturalism brought into the space was through WIC posters that were on the wall. And so there was this dire need for parents to say, like, I want this incorporated into the classroom.
Yeah. Well, that's great, Marika, and provides a really great segue too to our next speaker, Diane Halsey. Diane, who's also had the opportunity to moderate the focus group discussions with early care and education on the provider side. Diane, welcome. And as Marika kind of explained on the parent side, and especially on talking around the curriculum and cultural competency around parents, if you could share a little bit about your work of what providers shared and some key themes that you took away from what you heard.
Absolutely. Thank you, Sam. And so good afternoon, everyone. I'm so honored to be here and talk with you about what I heard from the providers. Again, my name is Diane Halsey. I'm the Senior Vice President of Family Engagement at Think Small. We are a nonprofit in the Twin Cities in Minnesota. And I had a great time with these providers. We talked a lot about a lot of different things, but there's a few things that really came through. And one of them I want to mention is that through the pandemic, providers are exhausted. And I like to say, if you know an early childhood provider right now, whether that be at your child's center or program, or just someone in your community, please give them a thank you, because they have been holding it down these past couple of years and are really true heroes during this pandemic. And they're tired. They're exhausted. And in fact, one of the comments I remember is one provider, the center-based provider, actually had a breakout of COVID and had to shut down for a couple of weeks. And she said, I was secretly happy because my staff got to rest, and because they were short-staffed and working really hard, and that allowed her staff to rest. And so they have been struggling. But what also came through is their passion, that they wanted to keep this high quality care going for their families, for their children, because they saw and recognized how essential it was for all the children that were coming into their care. And I will say that they also felt like the supports that they get, many of them got some support, some financial support during the pandemic, and it was helpful, but all of them were very concerned about when that support ends or did end, and what happens then, what happens with the cliff. And I will finalize by, yes, following up on the comments from Marika, the providers, all of them, many of them echoed those comments about culturally responsive care. They said it is essential for the children in their programs to have the kind of curriculum where the children can see themselves reflected. They also talked, however, about how challenging it can be to actually find that kind of curriculum, and that many times they find themselves having to adjust or add to the curriculums that they do have to make sure that it's to make it culturally responsive and culturally competent. But they saw that as an essential part of child development, is making sure that every child's culture and race was represented in the curriculum that they have.
Yeah, well, thank you so much, Diane, for sharing. Next, we're going to skip over to Susie. Susie, as an employer, you bring a different perspective to this conversation. Will you please kind of briefly explain the business services your company offers and why you were interested in creating a benefit of on-site childcare for your employees?
Sure. Thank you, Sam. So I'm Susie Lalich. I'm the Senior Director of Employee Success for a privately held company that's headquartered out in Livingston, Montana. We roughly have top line revenues of around $42 million last year. And our business services are comprised of e-commerce, printing, and marketing solutions for customers all across the country, as well as several years ago, we started to develop software solutions that really bring together the digital and the physical and create the ability for our customers to trigger sends based off of artificial intelligence. So we've moved a lot into more of the software as a service space. But several years ago, before I was employed here at PFL, my former manager, Marnie Reed, was expecting her first child, and she lived about 30 miles away in a bigger city called Bozeman, Montana. You may have heard of it. And the thought of leaving her child in Bozeman to commute over to our facility in Livingston was frightening for her. And so she started to talk to some of the other employees and families at PFL and realized that there was a common theme that a lot of our employees were looking to start families or had families, and they were really struggling to find high quality, affordable childcare that they felt comfortable leaving their children with. And so they put a proposal together and went to our then CEO, who had no problem approving the on-site child care center. So that was about 18 years ago. It first started in a house about 3 blocks away from our original location. And in 2006, when we were able to build a new large facility, we incorporated it into becoming an on-site location. And it's a subsidized program, so PFL does pay a portion of the cost, but we've over the years tried to keep it affordable for all employees. We have employees that are in kind of various income brackets, from 6 figures to childcare providers who make in our facility on average $17 an hour, which is still very difficult to consider paying childcare services on that type of a wage. So the program is still running. We currently have about 19 participants in the program, and we're licensed for up to 30. And we're anticipating in the next year that we will be back at full capacity.
Great. Thank you so much, Susie. And I really look forward to unpacking more of the discussion you provided, as we'll more likely have follow-up questions. Last, we'll have Yvette Sanchez-Fuentes. Yvette, you have had a chance to hear from a former early care and education provider, a parent with young children, and an employer that offers on-site childcare in a small city. From a broader systems and policy perspective, how do the comments that you heard today inform discussions of big picture topics in early care and education?
Yeah, thanks, Sam. Good afternoon, everyone. Buenas tardes. Thanks so much for the opportunity today to be on this panel. I ditto Marika's comments with all of these amazing women. It's really awesome. So I'm currently serve as the Vice President for National Policy at Start Early, which is a nonprofit organization that focuses on policy and services to states and communities. So this is a really interesting conversation. And what I want to share is that part of what's missing here, primarily throughout COVID, we saw a lot of money come into the system, right? We saw all of this money coming to states and then consequently, hopefully down to providers and particularly to family childcare providers and those individual women who are just trying to run their own little small businesses. But what we also saw was that the government decided to do a lot of programs, right? Give out a lot of grants in order to help communities reinvest or to build up their economic development. And so I want to go in a really sort of different place here and just sort of make this case that childcare and early care and education is connected to the economic development and prosperity of local communities, no matter at what level it is. But what we're missing is that link or that intentional connection between those programs and early care and education. And I'll give you one quick example about this. I read a blog today that was put out by the Policy Equity Group. At the US Department of Commerce, they're running these regional competitions that they're calling Build Back Better. And it's basically to give money, millions of dollars to economic development organizations in local communities and counties and states. There are about 60 finalists now. And of those 60 finalists, only 8 mentioned childcare as part of their plan towards revitalizing their communities, even though the application specifically calls out how childcare fits in. And I want to link this back to something that Sam and Catherine started with around race and equity, right? I think what we need to see and we need to think about is like, who are the people sitting at those tables in those organizations making those decisions about linking it to childcare in order to support our women, our families of color, our Black and brown kiddos, our Indigenous families, right? Like it all sort of comes together. And I think as a community, we're starting to see that there's this broader availability of funds, but how do we now make those links and how do we start to either educate and inform, but also hold accountable the people who are sitting at those tables making those decisions. And so I think there's a lot going on, but one of the things that we're missing is the link between childcare and early care and education and these broader programs that can help both reinvest in childcare, but also help communities reinvest in themselves. There's also programs, right, at the Small Business Administration that coming out of the state of Delaware and coming out of California, it's really hard for small providers or small businesses to access those funds because there's this disconnect between agencies like the Department of Labor at states and the agencies that run early childhood programs. And so how do we start to make those linkages so that we're getting more money into the system and we're primarily supporting higher wages, so then we can actually do all of the things that families and providers are telling us that we need to do. We already know what we need to do. Now we need to figure out how to pay for it, but we need to figure out how to prioritize early care and education in the scope of all of this other funding.
Yeah, well, that's great, Yvette. And I think you make a really great, valid point of thinking about who's at the table. And I'm sure that's been even more impacted due to COVID-19, as well as the rise in consciousness about racial justice and racial reckoning. And Diane, I know that you said that you're from the Twin Cities. So how's this really had an impact on your community? Are there providers in your area?
So I want to just really second what Yvette said. There is no way that we can really build back our communities after this pandemic without solid childcare, without really investing in the system. I think some of the I will say Minnesota, I feel is faring a little bit better than other states because our governor did actually ensure that we had some investments from the beginning. So, regular payments, that monthly payments were going out to providers to help them. And that is the kind of thing that we need ongoing to make sure that providers have some stability. One thing to mention is even before the pandemic, childcare is not really a good business model. The way the tools that we have to build childcare was not a good business model before the pandemic. We have providers, educators that are very low paid, yet and still you heard from the reports how incredibly expensive it is for families to pay for childcare, and very little subsidies to kind of help with that. So there were already a lot of advocacy going on and before the pandemic of getting those wages up so that we can really stabilize the field. Now, since the pandemic, there's an incredible shortage of providers and teachers that actually are staying in the classroom for various reasons. And so what we are hearing in Minnesota is that some providers are having to close rooms and not serve as many children. They're losing slots because they cannot maintain the workforce that they had before the pandemic. And that's a huge issue right now.
Yeah, well, Susie, if you could kind of speak to that as someone or an employer that has on-site childcare, how has COVID-19 kind of played into that? And Diane kind of spoke from her perspective and what's happening in Minnesota. What can you tell us that's happening in your community, especially from one that's services a small city?
Yeah, one thing in particular that's impacted our program was we do have the ability for a lot of our employees to work from home, and it wasn't an option necessarily that many of them had prior to the pandemic. And so when a lot of people did the massive exodus, they took their kids out of the program with them, and some of them have not returned. They're figuring out ways to care for their children on their own or through their own, communities in their neighborhoods. And that has had an impact on the numbers in our program, truthfully, because it does cost them money. They have found ways to provide care for their kids that's possibly more affordable to them. But one concern we have is, will that quality education and those developmental opportunities exist for those kids that they would have gotten had they been in a licensed facility such as ours? So that's one trend we're seeing. I don't know if that's something other areas are Our governor as well here in Montana has put a huge emphasis on childcare programs and really the rehabilitation of making sure that providers are being paid equitably, and really trying to ensure that there's sustainability for the programs that currently exist so that more don't end up going out of business. And then they've put some funds and appropriated funds to allow more people to start and initiate their own programs with some quality components being considered as well.
Okay, yeah, thanks for that. I do want to remind the audience, please do submit your questions into the chat box for our panelists. We're going to move to a Q&A in just a few moments, but I do want to circle back around here to Marika. We've experienced a pandemic within a pandemic, right? And we hear that supply on the supply side of childcare is starting was low during that time. It's picking back up, of course. What can you share with us, and what insights from what you're seeing in your community that you could share?
Thanks, Sam. I would say agree. I agree with everything that has already been shared, and I was doing like a major head nod when Yvette was speaking, and Diane, as they talk about what the experience has done, and as far as the inequities that COVID has further just shined a spotlight on that already existed. And I feel like as it relates to my community, I've seen families suffer because the breadwinner fell ill. In many cases where they were unprepared for it. And I know one of my bus drivers here, he died from COVID, and he left a wife and 3 small children, and she wasn't able to afford childcare and have the means to pay for the childcare that they had and to be able to sustain it at that time. And I'd say on my own behalf, early on in the pandemic, my husband was laid off because of COVID and because it took so long for test results to come back, and he was in the union, that it left us in a predicament of not knowing what funds were going to be able to come in. And then the kids ended up home, and I still had to work, and I was pregnant, and I had a COVID baby, right? Not that my baby had COVID, but I had a baby during the time of COVID. And that was a whole other story, and what I experienced as a woman of color, having a Black son during that time, and even how I was treated during that time. They were some scary times, but we've also mentioned that aside from the health crisis, that we have to remember that there was this dual pandemic and this racial reckoning that was occurring within our country, and that there was an uptick in centers that were focusing on diversity, equity, and inclusion, and then some that weren't, right? When Mr. George Floyd was murdered, there were some facilities that in my neighborhood didn't pay any acknowledgement to it. And I remember writing to some of them at that time saying, is anything going to be sent out? Are you going to acknowledge this? Because my kids were in that childcare facility at the time. And I remember them saying, oh, we are not going to be sending anything out. Typically, our children are not thinking and seeing these type of things in that way, along the lines of being colorblind. And my response to that was that my dollars would be going to a center that did see my children, right? Because that is something that is vitally important and critical, as we talked about having the cultural competency piece. And I feel like the other shift that I saw and that impacted my family as a whole were that hours the hours of operation changed for facilities because they couldn't cross mingle or commingle children coming in for extended early care. If you had children that needed to get dropped off at 6 a.m. before a center actually open for like their 7 a.m. time frame, they had to stagger their time. And so if you're in construction, or if you work these type of hours that just they're not standard hours from 9 to 5, that could have a major impact on you, on your family, and trying to navigate how are you going to get someone to care for your children so that you can still go into work. And I had to go through care.com. My sister was with me interviewing nannies to try to get, and that's not cheap, y'all. Like it can be like $20 an hour to try to get someone in just for an hour. And through that process, my 6-month-old fell out of a high chair and hit his head on the floor. And so there are so many shifts and changes that had to be made during that time, and trusting complete strangers in many cases during this time, because you just had to keep pivoting and moving. And my 19-month-old now, I've had to put him into childcare. And I don't even know, in some cases, you don't even get to know what it looks like inside. You don't get to check cleanliness. You don't get to check quality. You don't get to check and see if they have any of the cultural competence. You just have to now, which is traumatic, in many cases for maybe the child. And we say children are resilient, but even for a parent, when you just have to drop at the door and then just entrust that they're in a safe space. When I have had a child that was injured in a child care facility before and sustained a hole in her head and had 2 layers of stitches and a concussion, that is very traumatic to have to do as a parent. And so that is just a little bit and a lot of what I've experienced as a parent on that end during this time.
Well, I so appreciate you for sharing your personal experiences, Marika. And I think that it's something that definitely can be added into this conversation around policy and actually see where the gaps are. And definitely want to bring this conversation back to you, Yvette. And how do we be able to bring those voices? I mean, you already kind of talked about thinking about who's at the table, but how do we figure this out? And what are priorities that your organization is prioritizing during this time?
Yeah, thank you, Marika, so much for sharing that. I think it's really important for us to be honest and transparent about how the last 2 years have been. And I think we often just hear kind of the anecdotal stories that are real, but you hear them 3-4 people removed. So thank you for sharing that. I think, it started early, and I would say just across the country with national and state organizations in general, right? Everybody's talking about making sure that we center the voice of families and providers. But the question really is how do you do that? And how do you turn your intent into action? And so I know for me, it started early. One of the questions that we're asking ourselves is, as we're thinking about the types of policies that we want to influence, how comfortable are we going to be with making sure that we are co-creating, co-constructing, co-authoring, co-publishing, and sharing distributed leadership around what it is that we're going to push and influence. I think states and localities, we don't want to get stuck in doing the same thing because there's an opportunity here. And so you might as well shake it up a little bit and try to do a policy agenda, research agenda in a different way that actually, and I love what Marika said, I think you said, experiencing mirrors, that actually mirrors what families and providers are telling you should do. And so I think for us, it's really how do we actually put our intentions into action? The other point I just want to make is that childcare is still a private sector industry. And I think that that's part of what's making all of this so hard and often we compare it to K-12, but remember K-12 is a public sector industry. For those of you who have kids in the public school system, you never ask yourself how much is going to my kid's education, because you're going to drop your kid off every day and somebody's going to be there. But in childcare, it's all private sector. And so the importance of trying for people like me at the national level to make the connections between all of these different departments and all of these different funding streams is really critical. And I think, the more people we can bring into the space of not just saying childcare is important, but really take your intentions and put them into action.
Yeah. Well, thanks so much for that, Yvette. And before we cut to the Q&A questions and coming in with Matushka leading in, are there any final thoughts that the panelists like to share before we cut to the Q&A?
Sam, I'd like to follow up on a comment that Marika made about the dual pandemics that we are facing right now. And I think from the childcare perspective as well, when George Floyd was murdered in South Minneapolis, in our city, our twin cities pretty much basically erupted overnight. This was not only traumatic for our communities, but incredibly traumatic for our childcare programs. And I do want to say that, yes, young children were watching all of that. They saw all of that. Even if you tried not to have your child see a video on their phone or on TV, they are still hearing it. They're hearing it from their, because everybody was talking about it. So they're hearing it from their older siblings. They're hearing it from their parents and the community. Everyone was affected by that. And I think that there was also a desire to do that. But what we also saw was that nobody knew what that was. And so there was a credible amount of confusion, especially the days after. We're in the middle of a global pandemic as well. And it was very traumatic for young children. And I think that childcare programs tried to figure out how, some of them tried to figure out how to respond to that in due order. But there were, like Marika said, there were plenty of programs that decided that that was not their responsibility, or they simply just didn't know what to do, so they froze and did nothing. And so I just wanted to make that comment that that our children are now in the position where they have gone through this very traumatic experience as a community. And now I do believe that it is our responsibility in the early childhood sector to respond to that to figure out how we can help to do healing around that.
Well, thank you so much, Diane. I'm sure we'll probably have some questions from our audience that mirrors or can add to that conversation to help unpack that. Matushka, if you could just go ahead and do we have any questions from the audience?
We do. Like you've been saying, Sam, we welcome questions, and just a reminder on how to do that, submit them using the Ask a Question button on the bottom left hand of your screen, or you can also email us at communities@stls.frb.org. And I do want to open this up to everyone, all of the panelists. Some of the questions might be directed, but we would love to hear from all of you for sure. So the first question we have is, let's see, do you have any suggestions for conversations with legislators who say we don't have the luxury to focus on quality right now and just need to focus on access to early childhood care and education? And happy to start with anyone. Any thoughts on that?
I'm happy to kick it off. That's a really interesting question. I was just with providers this morning, and one provider said, something that really stayed with me. She said, we can do all of these things because the thing that childcare providers do, like they actually build rockets out of cardboard boxes. And so if they can do that, then we can prioritize and simultaneously create the systems that we want. It's just a matter of our elected leaders, our leaders in general, making those decisions to say, yes, we're going to use funds, or we're going to be creative about funding, or we're going to find other resources to both prioritize stabilizing the field while at the same time thinking about how you're going to increase wages, how you're going to increase quality, and how you're going to link to all of these other funding and programs that are happening in other parts of government and public sector.
Yeah, I want to just follow up with that. I couldn't agree more with Yvette. And all I'll say is, nobody ever talks about should we just have access to K through 12, or should it be quality? I mean, I don't think that there has to be an either or in that discussion, but for some reason, when it comes to childcare, people want to make it an either or. It doesn't sound like rocket science. Yes, it should be high quality. Yeah, it shouldn't be an either or.
I agree. If I can just add in, I find that either or thinking is dominant culture type of thinking, and we have to move away from that. We have to really think about like what Yvette said about coming together and partnering in the work. And it's not just building it and then they'll come because you know that they need it and because they need to go to work, but it's really looking and seeing who is at the table and taking an equity pause, like pause and ask yourself those questions. And they need a series of questions to say, who is here and who isn't here is the biggest question, right? Who are we not representing? Who is the marginalized group that continues to be that marginalized group that has to continue to take a back seat and that does not have that access to that quality care? And we know that that has been like system long, like we could talk about how many years that has been in the work, from redlining into how where you just forced into certain areas. But until that entire system is dismantled, we're going to continue putting a Band-Aid fix. But we definitely, I agree with you that have to make sure that we have the right individuals at the table and they have to ask the right questions.
Our next question, what are some of the most effective policy solutions that you all are looking at to address the broken business model of childcare? And what are the funding streams to support these solutions? I thought, Diane, maybe as a provider, we could start with you on this question.
Well, I think that's an excellent question. I was thinking about in Minnesota, our governor just put together a budget that had like everything in it that would to deal with this system of childcare. So there were things in there that had there was money for increased reimbursements for the child care assistance program. There was increased dollars for early learning scholarships for people. There's also money for the providers sector. So you're able to give scholarships to people to go back to school, to increase their education. I mean, that's the kind of things that we need. We need support, and the kinds of support we need are at the level, are at the dollar amount that we need government to step in. We need that kind of money to really subsidize this field. Like Yvette was saying before, childcare is not a public sector right now, and so paying for it lands on the backs of families. Like all of our families here, and the amounts of dollars that we are paying go way above how much people can really afford. So being able to subsidize the field to make it affordable, and also providing those subsidies so providers can continue with their professional development, wage subsidies, all of that are good policies for really helping the field.
Okay, jump into really quick. I think, engaging more of the private sector, like my organization, we have spots that are not being utilized right now. And so I'm paying staff that isn't at their full capacity. And I know that there's other organizations in Bozeman that they open up their seats to other companies and they do kind of co-oping. And that's been a really great way to just increase the availability. I know not all companies have resources to be able to do that, but incentivizing through tax credits and those sorts of policies is certainly one thing that has helped keep our program running.
Susie, I'm going to pick off of what you were saying and look at this next question here that I didn't think we would have time, but I just think it speaks to maybe a little bit follow-up of what you're saying. Are there opportunities for philanthropy to become more involved in childcare issues? Are there examples of private foundations engaged in these issues?
There are. We have two organizations in the state of Montana, the Arthur Blank Foundation and the Washington Foundation, and they are heavily involved in working within the sector to solve these problems. And so, they're there with not only dollars, but they're, hiring people who go out into communities and do research and are really looking to move the needle on this. I haven't stayed as involved recently, but I know there are a lot of those philanthropic efforts that are driving things forward.
All right, I'm going to close with one last question as we come to the top of the hour here. So we've heard about the challenges for families and providers throughout the pandemic. Have there been any positive changes and or opportunities due to learnings from COVID? Any thoughts from anyone on that?
Yeah, I mean, I can start with that. One specifically. I don't know how much folks know, but Washington D.C. recently in their budget increased wages to childcare workers. So that's really big because that is all public sector money. So they are definitely both stabilizing and raising wages. And then the other piece I would just also mention is, and this is, I think it was pre-pandemic, but in Oregon, Multnomah County, right, they also, voters there approved a personal tax income increase in order to pay for high quality universal pre-K, which includes higher wages to staff. So I think one of the things that's really important, building on from what Diana said about the governor, it's important for states and localities to start where they're at, but I think also to think about what are those federal resources that can help to subsidize and close any gaps that exist.
Thank you, Yvette. Anyone else?
I think from a parent perspective, I can share that, and then also as a administrator here in Lincoln, that one thing that I've seen us invest more money and time into is professional development, which prior to the pandemic, when I would ask questions as a parent at other facilities, I would get we just don't have enough money in the budget to be able to cater towards that. It's coming out of my own pocket. And here I've seen us have equity stances and statements. And now there's like strategic priority maps, and they're making sure that teachers are trained to really focus on anti-racism, inclusion, diversity, and equity. And I think that is helping with the mirrors and students being able, and children being able to see themselves reflected in the classroom and the lessons and the books, and bringing the families in. We've had to figure out a way to incorporate families in a deeper way, since they can't actually physically come into the buildings. Now we have like mystery readers virtually, and there's other ways that we're inviting them into the classroom, which I think has been a positive.
Thank you, Marika. And I think we're going to have to call it there. I'd like to thank all of our speakers today for sharing time with us, as well as all the participants that joined today. We had great questions and great conversation. So thank you for joining us in our discussion on high quality early care and education, cost, affordability, and racial equity. A few reminders: we will have a video recording available of today's session on the Connecting Communities website, and you can find a variety of additional resources available on the Fed Communities website. We also welcome ideas for future recordings. We just shared a survey link if you joined us in the webinar, and the same link will be distributed via email in a few minutes. We appreciate your feedback about today's session. I also want to share that we do have an opening for our April Connecting Communities that just came up for April 14th. So please reach out to us if you would like to host an event coming up. Well, thank you for joining us. This concludes today's Connecting Communities webinar. Enjoy the rest of your day.